Well, thank you so much. It's my great honor to be here with all of you today. And I look forward to this little bit of time that we have together to explore how music can be used in a very purposeful way in our everyday lives to help promote a greater sense of wellness and connection. At Memorial Sloan Kettering, music therapy is part of the integrative medicine service. And for anybody who may be a little unfamiliar, integrative oncology is really a patient-centered field that that uses evidence-informed approaches from different healing traditions alongside conventional cancer treatments to optimize health. We focus on lifestyle modifications, mind-body practices, and some of our staff also focus on the appropriate use of natural products. And we partner with other organizations. And so also, I'll just point out some of the other modalities in addition to music therapy. We have fitness, yoga, martial arts, acupuncture, massage, and meditation. Many people always ask, what is music therapy? There are many different definitions out there. This one I feel really encapsulates the way that I practice. Music therapy is a systematic process of intervention where the therapist helps the client to promote health using music experiences and the relationships that develop through them as dynamic forces of change. So really, it's the client's own use of music that is at the crux of the work that we're doing. Some of the underlying concepts that I find as important guiding principles is the fact that sound is energy and music is multidimensional. We interact with it from a physical standpoint, um, from an intellectual or cognitive standpoint, psychologically, emotionally, and spiritually. Music is personal and it's not prescriptive. We don't say, listen to Mahler's Fifth the night before you have a procedure. We say, use the music that is important to you. The concept of entrainment is the fact that human beings have this tendency to synchronize with rhythms. And also, I feel it's very important that when somebody is participating in music therapy, they are like an explorer. And the job of the therapist is to be maybe a little bit of a Sherpa, if you will. One of the reasons why music therapy has been gaining more attention in the world is the fact that neuropsychology has really started to catch up with what music therapists have long observed in practical work. And we can see now that when we are engaged with music, whether we are singing, playing, dancing, creating in some way, or listening with real intent, that there are many parts of the brain that are activated. And this can help to encourage, improved function in some ways. I also wanted to just mention that because so many people do experience anxiety on a regular basis, we're finding that, especially with cancer survivors, people are interested in finding approaches for management of stress and anxiety that are non-pharmacological. And so we actually have been working with the psychiatry department. There's a cognitive behavioral therapy plan that is seen as a first line treatment for anxiety. but we are also interested to find out if there's room for music therapy in this approach. And so we are conducting a randomized trial to compare the effects of music therapy versus CBT, cognitive behavioral therapy, for the management of uh, anxiety. So if anyone here is seeing this and thinking that they might be interested to learn more and find out if they would like to participate, the number here on the screen you can use. I'll bring this slide up again once more at the end of the presentation. So don't worry if you're not able to catch this right now. And then very briefly, before we get into doing some music together, I think it's important just to share. People always ask, what happens in a music therapy session? What is it all about? And it really varies according to the interests, the energy level, and the needs of the person who is engaging in the music therapy session. So sometimes we'll do some music listening together. We may look at the lyrics, we may talk about the meaning of the songs. Sometimes because uh, music can bring a lot of important memories back to the fore, we might talk about what's been important in someone's life. We might use music to help create a feeling of relaxation or to give an opening for creative expression and emotional release. So often in my work, uh, music therapy, especially when we're working in the hospital, is focused on symptom relief. So somebody is feeling some kind of discomfort or emotional discomfort. They may be also feeling exhausted, not uncommon. Um, Very often, also, people feel isolated. They're not able to see everyone they would like to see or just do what they would normally like to do in their day to day. Also, music therapy can come and meet people very often at that crossroads where they need something that's giving them some kind of spiritual support and speaking to the meaning of their life. And also, we find that in sharing music, we can help to support communication. So our sessions can be receptive or interactive. We may use music that's familiar, or it may be improvised and novel to the moment. We may do all instrumental work. We may include vocal work. There could be verbal processing, but there doesn't have to be. And I most often use live music, but also recorded music has its place. So in a receptive technique, as I mentioned before, we might do some music listening together. And another important component is the music assisted relaxation, which we will try together in a moment. I tend to use live music and often include some verbal cues for paying attention to one's breathing or the sensations in the body. So here we are. You can use this image, or if you close your eyes, you may find that you have an image of your own, of a place that is beautiful, calming, and comforting. And I'll just invite you all to join me in a few minutes of just using the music and the words to do a breathing meditation. So if possible, I encourage you to take a moment to notice how you are in this moment. Are you sitting? If so, do you feel supported? Do you need to make an adjustment? If your feet are on the floor, take a moment just to notice how your feet are being supported by the floor underneath you. You might be standing, or you might be lying down. All of that is fine as long as you take a moment just to realize that you are where you need to be right now. Accepting all my body, relaxing away the stress, breathing deeply and slowly, dissolving knots in myself, and filling myself with light. Breathing in, my breath goes deep. Breathing out, my breath goes slowly. Breathing in, I open my body. Breathing out, I relax my body. Dwelling in the present moment, I breathe in. Enjoying the moment, I breathe out. Aware of my stability, I breathe in. Enjoying my stable posture, I breathe out. Breathing in, I am calm. Breathing out, I am relaxed. Breathing in, I smile to myself. Breathing out, I say, I am home. And now, as the music begins to find its ending, we may take another breath together and let it go. We just take a moment to wiggle our fingers and take a gentle stretch, allowing the eyes to open gradually when we're ready. So thank you for taking that little break with me. And in sessions where we are um, not doing as much of the relaxation work, we may be spending more time really actively making music together, singing, um, working on some instrumental skills, doing a songwriting, or just improvising together. I like to always have a variety of instruments when I go in to see somebody, and I like to have percussion instruments because you can, without preparation, really enjoy um, just immediately jumping in and doing something. And I think it's really important to create a field of play where there's an openness, there can be structure, but also freedom to explore. There may be a sense of people playing together, matching. Sometimes when I go to a room, I'll see the family members visiting and they'll also join this session. So we may have a miniature group playing together, which can be lovely too. I thought it would be really great to be able to do a little bit of vocal work together today. And so um, I just want to say that, you know, some people say that they enjoy singing, but they don't think that they have a nice voice, or they don't think that they don't want other people to hear them singing. Um, so, you know, it's important that this is not a concert. It's not you know, something that needs to be perfect, but really to take a step back and think, wow, when we sing, we have to think about our breathing, or maybe we don't think, we just naturally start to breathe a little bit more deeply. And when we're enjoying ourselves and singing, we can actually release endorphins, some feel good hormones. So we find that it can be a great mood lifter and a great way to release tension. Our voice is from our body. It's really a mind and body practice to sing. And it's a wonderful way to express ourselves and allow ourselves to be creative. So what I'd like to introduce next is the concept of vocal toning. And in this instance, we're really not singing a song, but we're really giving ourselves the opportunity to notice different tones where we feel them vibrating or reverberating in our bodies. And so I have this diagram here with the chakras. We tend to notice lower tones. We may be feeling in a lower place in our body, with higher tones feeling in higher places. So I would like to just give a little example of that, and I hope that you can join in. I'm going to just use vowel sounds starting with ah. But as we go, you don't have to do exactly what I'm doing. You can feel free to do whatever you'd like. And we might just begin with a little scanning. So maybe starting with a low tone, whatever low might be for you. Ah, ah, as just a short warm up. I'll support us with some chords here, but you can certainly play for yourself without having an instrument. If you don't have a piano nearby, or another, or guitar. So I'm just going to begin singing on ah, and I'm exploring different tones. I may change the vowel sound as I go, and you can certainly do the same thing. Ah, ah, ah. So that's just a brief example of vocal toning. Sometimes it's a way to open up the voice, open up the breathing apparatus, as well as allowing yourself to just live in the space of tones for a few minutes. Another way to use our voices is to use chants. It's really interesting. There are chants from so many different traditions throughout the world. And the sense of repetition in a chant can allow ourselves to just get into the music without worrying about what comes next. It's very easy to learn a chant. It tends to have very few words. And again, that repetition allows us to kind of just get into that space and that sensation of using our voices. So one that I would like to share is actually something that could work well with a rhythm behind it. This chant is called "Take Time," and so I'll just begin, and I hope that you'll join in with me. I was passing by and you called me in and you said to me, you better take time in life, won't you? Take time in life, won't you? Take time in life, won't you? Take time in life, 'cause you've got a long ways to go. I was passing by and you called me in and you said to me, you better take time in life, won't you? Take time in life, won't you? Take time in life, won't you? Take time in life, 'cause you got long ways to go. Oh, one more time. I was passing by and you called me in and you said to me, you better take time in life, won't you? Take time in life, won't you? Take time in life, won't you? Take time in life, 'cause you've got far ways to go, to go. I'm sure that you can think of some chants that are familiar to you that you may want to come back and use in your own practice. I would like to also make sure to share with you all some resources for for music and meditation. The first here is from our webpage. We have something called a meditation station, and we have several different tracks of different lengths of meditation and some music tracks as well. We also have a survivors chorus, and some caregivers have also joined, and it's a wonderful group of people at Memorial Sloan Kettering. So feel free if you would like to check that out. I also encourage anyone who would like to get back into making music to search your local area for different kinds of groups that you might want to join: choirs, community bands, and orchestras, drum circles, maybe form a rock band with some friends, any opportunities that that you may be able to search up. I think being able to find opportunities to join together with other people, especially these days, more and more people are doing things in person again. It's a wonderful form of self-care if you enjoy making music, to keep that in your life. And if you're just simply curious and you'd like to learn more about the profession of music therapy, I encourage you to go to the American Music Therapy Association The webpage is listed here as well. And in addition, we have something called the Integrated Medicine at Home program. And the webpage is listed here at the bottom. Two of the classes that take place during the week are led by music therapists from our team. We also have a dance therapist who does some great classes in addition to fitness, meditation, kung fu, tai chi, yoga. I think I covered them all. Here again is the information for anybody who's interested in the Melody trial, comparing music therapy and CBT for cancer-related anxiety. So please feel free to take a picture of that slide and give us a call if you are interested in learning more. Since we have just a few minutes left, I thought it would be great to end with this song, Lean on Me. It's a song that's been around for a long time. I've noticed it's actually been covered by quite a few artists. And so if you feel like just being able to sit back, relax, and sing a song, we can close out with this. Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong. I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. Please swallow your pride. If I have things you need to borrow, for no one can fill those of your needs that you won't let show. You just call on me, brother, when you need a hand. You won't need somebody to lean on. I might just have a problem, you'd understand. We all need somebody to lean on. Lean on me when you're not strong. I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. If there is a load you have to bear that you can't carry, I'm right up the road. I'll share your load if you just call me, call me, call me, oh, call me, call me, call me, call me. All right, thank you. I meant to change brother to sister for today. Brothers and sisters. All right, we can call on each other. Thank you so much for giving me this time today. I don't know if there's time. I guess there's just a minute and a half left. If there were any comments or questions that we can answer, I'd be happy to. Oh, okay. Thank you. We don't do questions. Okay. Well, I really loved being a part of this incredibly vibrant community today. And thank you so, so much for the interest. I hope everyone has a beautiful musical harmonized rest of the weekend. Take wonderful care, everybody.